Now, while illness can happen across the lifespan, there are certain times in life when people can be more vulnerable to illness. Of course, childhood is one such time period, and aging is another very important time period, because aging is a period of rapid decline and it makes people additionally vulnerable to any kind of illness and disease. Now, as people grow older, a lot of changes happen in the body, almost in every organ of the body. Say muscles, bones, joints, all the sensory organs such as skin, nose, ears, eyes, as also several other, bowel and bladder functioning. Similarly, metabolic, immunological and hormonal changes. Such a lot of changes happen in the body as a result of aging. And all these changes indicate a deterioration in functioning. For instance, there is a loss of muscle mass, bones become more brittle, joints become more brittle, there is a loss of balance, sensory functioning declines, bowel and bladder functioning declines, and so on. So basically, aging is a period of decline. And this is a natural factor, in fact, because aging is marked by such kind of changes. Of course, not all people will experience similar kind of changes. Certain people may experience changes more in certain organs or certain parts of the bodies, whereas others may experience a general deterioration and so on. But the fact remains that this kind of decline as a result of aging is both inevitable as well as it is irreversible. And also, this kind of decline increases greatly the vulnerability of the elderly to contracting a lot of diseases and illness. Apart from this physical vulnerability, aging is also an age which causes a lot of psychosocial and emotional vulnerability, because aging often is characterized by loneliness. People lose a number of their friends, their peer groups, their spouses, and they are left alone in life. Their children may be out for studies or for work, they may no longer be with them. And once the elderly retire, they may suffer from a lot of boredom and a lot of anxiety and frustration also, because they cannot cope up with their daily living skills. They have to be dependent on different people for fulfilling various kind of responsibilities. Similarly, they may have a lot of problem in adjusting to a new life, particularly after retirement. And financial concerns may crop up because there is a loss of source of income and so on. Elderly find it difficult to adjust to the many changes that are happening in their body, as also to illness. So all this stress also creates a very volatile emotional atmosphere. And as we know, emotional well-being is connected to physical well-being. And when there is an emotional problem going on, it additionally makes the elderly more vulnerable to physical disease. Now, the elderly may experience a host of illnesses and diseases ranging from cardiovascular problems, bowel and bladder problems, gastrointestinal problems, cancer of various forms, respiratory problems, and diabetes, and a host of such issues. Because in any way, the elderly body is vulnerable to a host of illnesses and diseases. And of course, the outcome of these illness and disease is also more severe for the elderly than in any other part of life, in fact. So today in this lesson, we are going to see what is the impact of illness on the elderly, as also on the families of the elderly, because illness doesn't impact a person, it impacts families. And secondly, what we are going to see is how can we cope with illness in the elderly, both in terms of how the elderly can cope and how the families can cope, because just as illness is not of the person but it is of the family, similarly coping is also not of the person, coping happens in families. Impact of the illness on the elderly. Now we are going to see how does illness during aging impact the elderly. Illness of any kind, in fact, can have an extremely debilitating effect on the elderly, because it adds to the already existing physical and mental vulnerabilities. It again taxes the body, which is already worn out and which is already tired. And if this illness happens when already the person has an existing illness, then the problem becomes extremely exaggerated and it becomes very difficult for the patient to manage one illness over the other. Further, there can be a lot of social problems that can happen, which is an impact also of illness in the elderly. Especially if the elderly person is living alone, It can cause a lot of feelings of anxiety, guilt and insecurity for the person, because he will have to depend on others, either children or relative or friends. Many of them will be far away. He will have to depend on them for all kinds of assistance. Particularly if the elderly person is not financially independent, it creates a lot of embarrassment and it also creates a lot of insecurity in the person. Another major impact that particularly happens for the elderly is that of hospitalization. Many a times when illness happens for the elderly, it becomes difficult to manage it at home, because the person is already weak in the bodily sense and there may be many comorbid illnesses, many illnesses happening together, and it becomes difficult to take care of them in the home setting, and hence hospitalization becomes an inevitable option. Hospitalization is not an easy option for the elderly, because it removes a lot of choices in their life. It removes a lot of known circumstances from their life. They may feel anxious, frustrated, irritated and very angry also, in fact, that they have to be in the hospital with unfamiliar people undergoing unfamiliar procedures. In fact, delirium is one major factor that affects elderly in the hospital. Delirium or a disorientation, a lack of orientation of time, space or reality happens probably because the elderly may be subjected to a lot of changes in the regular routine. They may be exposed to a lot of bright lights and unfamiliar people, particularly in the night time. They may have a lot of sleep disturbances. They may be woken up many times in the night for various tests, for various procedures and so on. So automatically this creates a kind of disorientation. Well, hospitalization leads to disorientation for many age groups, in fact, but for the elderly it is particularly risky. Of course, they may get over this disorientation, most of them do, but when they get over this delirium, the brain functioning comes to a new low, and then the functioning resumes from that low. So it doesn't go back to that stage where the brain was before the delirium happened. So this again is a very risky factor. In addition, hospitalization has its own particular risks for the elderly, because as I repeated again and again, the elderly body is first of all weak and vulnerable, and an hospital atmosphere may have a lot of other diseases, viruses and risks involved. So the elderly person stands in the risk of contracting many other illnesses also from the hospital. In addition to the illnesses, the many hospital procedures, the shifts, the many equipments involved can also bring about the danger of some kind of injury, some kind of loss of balance, some kind of fall, which may again create a new health condition altogether again. Hence, the impact of illness on the elderly becomes a quite complicated affair. From the family, from the point of view of hospitalization, from the point of view of the patient's own adjustment, the impact is huge. Impact on the family. The chronic illness for an elderly person automatically also impacts the family members. Family members, particularly children or other close relatives, have to bear the brunt of the responsibility. And most of them may already be managing their own families, their own children, their own spouses and their own careers. And they have to bear this additional responsibility, this entire change in routine and a lot of time pressures as they care for the elderly patient. Caring for the elderly patient may require lots of hospitalization, lots of waiting at the doctor's office for various appointments and tests. It may also involve a lot of sleep deprivation, round-the-clock care and so on. Automatically, the family members feel pressurized for time. They feel an extreme loss of energy as they try to juggle their own families and the needs of the elderly patient. Such a kind of situation can also create conflicts between the family, say among siblings, because one sibling may feel that they are doing too much for the elderly person, whereas the other siblings are not taking equal responsibility. Especially if there is one sibling who lives close to the elderly person or with the elderly person and the others live far away, this child may feel that too much of the responsibility is being placed on him or her and the others are not taking up their share. So automatically it also leads to a lot of conflicts in the family, which can be a source of tension for the elderly patient as well. In addition, if suppose the elderly patient is not financially independent, it additionally puts a financial pressure on the families who take care of the elderly patient, and this also can be an extremely confusing and an extremely pressurizing situation. In cases where families and children stay away from the elderly person and he or she stays alone, it can create an additional problem in the sense that children or significant others will have to travel long distances or take turns to stay with the patient and take care of the patient. And this can be an extremely complicated affair to juggle their own chores as well as deal with these demands. In such cases, sometimes out of the hopelessness of the situation or the time desperations involved, children may decide that the elderly person be taken care of by a caregiver, whereas they come in between to visit. Now, this can also be a very tricky option because many elderly patients resent the fact that they are being taken care of by a caregiver when their own family members are present. So in case of such resentment, the family members, particularly the children, may feel a lot of anxiety and guilt that they are not being able to take care of their parents or others who have at one point done so much for them. So sometimes it may involve the child totally shifting his job and his family and coming back to the parent or the significant other to a place where medical care is easily available for the elderly patient. Even then, it involves a significant relocation, which can create a lot of conflicts because new jobs will have to be found, new schools will have to be found for the children, and so on. In many ways, illness in the elderly becomes a total issue which has a total and comprehensive familial impact as well. Coping with illness, coping among the elderly. Now we come to the next step, that is how to cope with illness, now that we know what the impact illness has on both the elderly and their families. First, we begin with how the elderly can cope. One basic factor in which the elderly can cope with illness is, of course, lifestyle changes. And this is both preventive coping and it's also curative coping. Because a number of lifestyle changes such as a healthy diet, regular exercise, regular sleep patterns, cessation in smoking and moderation in alcohol intake and such other lifestyle changes can go a long way in preventing illnesses as well as reducing the symptoms and severity of the existing illness. Another very good practice and very good lifestyle measure can be to be in regular touch with the healthcare provider. Particularly if you are suffering from certain diseases such as diabetes, it would be very necessary to be in touch with an eye or foot doctor, because all these diseases have symptoms, have repercussions which without proper regular care can create a lot of issues. Similarly, it is always good to have a very proactive role in your own medical evaluation and medical treatments. You can discuss with the doctor periodically and review all the medications that you are taking. In case if you are taking any kind of alternative or complementary medications, those can also be revealed to the doctor and discussions can be done of the possible interactions and side effects. Similarly, any kind of new symptoms, any kind of troubles, any kind of tests or vaccinations, all these things can be discussed. This kind of lifestyle change of a healthy lifestyle and regular medical checkup can prevent a number of illnesses as also reduce the existing illness. A second factor that can be taken into account in coping is tests. Regular tests in fact can identify certain hidden illnesses. Also they can judge what the prognosis is or what the progress is on a current illness. A number of tests are available for any kind of age groups. These may involve cardiac tests such as cardiac stress tests, what we regularly call the treadmill tests, or angiograms, or something like lipid profiling, thyroid profiling, other hormonal profilings, blood test which measures blood cholesterol, blood sugar, a number of tests for colon cancer, breast cancer, prostate cancer, and so on. A number of tests are available, and these tests, as I said, perform twofold functions. They can identify illness, they can judge the level of the illness. Also, what can be done is to approach the doctor and see what particular tests suit each particular person, because much of the tests we mentioned are general tests, whereas every particular person may require a unique set of tests which the doctor can recommend. And having such regular tests can be a great coping mechanism as far as illness is concerned in the elderly. A third measure that can be taken is safety measures. So if you take a number of safety measures, you can ensure that illness is prevented when it can be, and at least it is not aggravated when it is possible. Say for instance, taking a lot of assistive technologies when necessary, say using a cane or a walker or crutches or wheelchair, can be an extreme safety measure when required. Similarly, simple things such as using a shower seat when having a bath, because many a times it is seen that elderly do slip and fall in the bathrooms and have a lot of fractures, which again becomes a very complicated affair. So having good carpeting on the floors, good lighting in the house, as I said, having shower seats, similarly having assistive technologies like glasses or any other contact lenses, and stopping driving when you can no longer do it. All these things can be urgent safety measures which can prevent a lot of chances for illness and injury. And advising this to elderly patients whom can also be a useful thing. There are certain other things also that the elderly need to do. They also need to make what is generally known as a living will. Because many elderly patients suddenly may have a stroke or something so debilitating that they can no longer make medical decisions for themselves, and this leads to a huge confusion and conflicting situation over who will make the decision next. So it is very useful for the elderly to put a living will to clearly authorize any significant other or significant person who will make medical decisions when this person cannot make decisions on his own. It can also be useful to have a list of emergency medications, emergency numbers, as also a list of the things that the elderly are allergic to in case there is an emergency and the patient himself is not able to say that, see, I have an allergy, say a penicillin allergy and so on. So if you have a list handy, someone who is taking you to the hospital can do the job for you and you will be safe. One important thing that can help the elderly cope with an illness is a lot of emotional support, and this can be provided both from the family and from the community. Many times elderly have a lot of problems also because they live alone, because they do not have company, and the world that they know now is very different from the world they had known all their lives. So it's very important for friends, children, other family members and other members of the society to make sure that the elderly feel emotionally secure. Even if it's not possible to visit the elderly on a daily basis, phone calls, calls over the internet, letters, all of these can make a huge lot of difference. Whenever there are small functions in the family, they can be kept within the family itself or at the home so that the elderly can easily attend it. Something like the birth of babies or marriages and so on, because the elderly will feel that they are still valued, that they still have an active role to play if they can participate in such kind of familial gatherings. Similarly, using photo albums, using favorite movies or favorite music, all these can do a lot in bringing back the old memories, in making the patient feel loved, feel cared for, and this can go a long way in aiding improvement and recovery. One basic thing that should be focused on is to make the elderly feel wanted, because many a time they feel that they have nothing more to do in life, no more roles to complete, and this leads to a deterioration. They feel that they have no reason to live. So involving the elderly in all these kind of social activities gives them a meaning in their life and a reason to live. Similarly, they can be encouraged to participate in a number of community activities depending upon what their interests are. Say a person is involved in music, or is involved in walking, or is involved, say, in some other religious activities. Accordingly, they can be made to join interest groups so that they find people who share similar interests, and they find some kind of routine in their lives despite the illness, some reason to get up and go outside the house. Also important is leisure and planning. So planning for the elderly should always involve their own choices. You can do simple things which can make them feel much better. For instance, teaching them how to use, say, the remotes of a VCR or a television or a radio can go a long way, because they can feel in control. They want to watch something, they can immediately switch it on and watch. Similarly, asking them what books or what music they would like and bringing it to them, or asking them their choice, where do they want to go out, or what kind of food they would like to eat, at least for a change. All these things can go a long way in making them feel wanted and making them feel in control. Also important is to plan for the future, plan for any kind of emergency. So you can ensure that certain funds are kept aside so as to take care of the elderly. In fact, the elderly can be informed of the same also so that they feel reassured. Similarly, the medications that they have to take can be clearly divided into different sections so that even if they are alone, they can easily retrieve and take it. Similarly, setting up reminders or reminding them that this is the time you have to take the medication. All these little plannings can go a long way in reducing your stress as well as reducing the impact of illness on the elderly. Coping with illness in the elderly, coping for the family. Now, just like we have said repeatedly, illness and coping doesn't happen for a person alone, it happens for the family. And as we have seen that families do suffer a lot of impact when the elderly fall ill. So how do we cope? Let us look at some basic things that can help us cope or help the caregivers cope with chronic illness in the elderly. The first thing which is important is that you should accept your feelings. As a caregiver, as a family member, you may have a lot of feelings when the elderly fall sick. You may have frustrations, you may have irritation, you may have a lot of depression, you may even feel angry at the family member, or you may be suffering from a lot of grief because you know that the family member is suffering from a terminal illness and that death is inevitable. So all these feelings may be there in you, and you may also feel guilty that you actually feel all this, that you feel angry at your own parents or significant others, and that too in a situation when they are ill. But it is important to remember that all these feelings are normal and natural because all of us are human beings. And what we need is a person who can listen to all these feelings so that we can ventilate all these bottled up feelings and feel better. All these feelings are natural, and sometimes support groups or professionals can actually help you in ventilating these feelings, because once the pent up feelings come out, going ahead with life and going on with the difficulties becomes a much more easier task. Not only can professionals and caregivers give you a listening ear, but they can also counsel you regarding the ways in which you can better manage your feelings. A second important tip for families to cope is don't try to do everything yourself. Many times children and others feel so responsible for the elderly that they feel that I have to do everything. I should not make the person feel wanted in any way, and everything should be done under my supervision. But this is not going to be possible, because no person can actually take the entire responsibility of caring for the chronically ill unless he or she wants to suffer from an inevitable burnout. So it is important to plan strategically and share responsibilities among the different family members. Say for instance, you are a person who is living closer to the elderly person, whereas all your other siblings are staying far away. You can strategically manage different responsibilities. For instance, since you are close, you will have to take actual physical care of the elderly person. Someone else who is far away but can concentrate more on his job can assist a bit more financially. Someone else who has a lot of time at hand and who can explore treatment options can actually research more about the illness and give you some tips on the same. Yet another person who has the ability to take a bit of vacations can actually think about organizing some family leisure time for all of you to get together. So it's important that you divide all these responsibilities and plan it out, because if you plan to do everything yourself, it is inevitably going to fail. Another important factor that you have to do is ask family and friends for help. Many people feel very embarrassed to ask for help, whereas it is important to remember that all of us require help at some points in our life. And many people are ready to help only if they know that you actually require help and what kind of help it is that you require. So be specific to people about the kind of help you require, and you may actually find a lot of support systems, both professional as well as from among your friends, and these can easily lessen the burden of taking care of the chronically ill. And one final point is to attend to your own needs. While looking after the chronically ill, one basic factor is of course time pressure, and in the time pressure you may forget about so many of your own needs. At some point it is important to hand over the care of the elderly for a few hours offer a day to another professional caregiver and take some time out for yourself. Engage in some leisure activity, or go and have a grooming session for yourself, or some kind of spa treatment, anything that makes you feel better, because you deserve it. And it is not, and you don't need to feel guilty about it, because it is not going to impact your caregiving of the elderly. In fact, it is going to better the experience. Once you come back rejuvenated, you can take better care of the elderly person. Sometimes, at least for shorter durations, caregivers can also opt for long distance care. Suppose they want to go somewhere, or suppose they have some urgent work to do. In such cases, it would be useful to contact the hospital and other support systems for what is called case managers, who are authorized people who do take care of all the medical logistics of the patient, including the caregiving, who regulate the doctor appointments, the medications, and all other details. And in addition, you can monitor it from a long distance, as also keep in touch with the elderly patient. This can be an extremely useful option in case you have no other choice but to move out for some time. It's also important for caregivers to particularly look after their physical health, because what happens is many a times patients also do not respond properly to the kind of caregiving. There may be a lot of conflicts between the patients and the caregivers. Patients may misunderstand the motives of the caregivers, and this leads to a lot of depression, anxiety, and frustration. And often a result of this is that caregivers often indulge in practices such as alcohol or smoking or unhealthy diet, which gives some kind of temporary relief from the stress, but this can be extremely detrimental in the long run. So it's very important for caregivers to eat right and have the right amount of exercise, because depression can also lead to a kind of lethargy, so that after the caregiving you are just too tired to do anything else, so you end up just sleeping, or not giving any time for exercise. Even if it's not possible on a daily basis, at least a few times a week, at least 30 minutes of exercise per day would be very useful. Similarly, eating a healthy diet, avoiding any kind of temptation to go into alcohol or smoking for reducing stress is also important. Also very important for the caregiver is to get themselves checked periodically, because in the entire stress of caring for a chronically ill patient, they may forget that they themselves may be developing a lot of health issues, especially because they are stressed. So regular checkup with a medical care practitioner is also something which will be very essential for the caregiver. Conclusion. Hence, in this chapter, what we have learned is a lot about illness and aging. Illness and aging are two factors that interrelate with one another to create a lot of specific and special consequences. Much of the problem arises because we see illness in the elderly as something similar to illness in various age groups. But what we must understand is illness during certain vulnerable life periods is quite different from how illness is in different other lifespan as compared to illness in different stages of the lifespan. Awareness is one important factor, because awareness can help you take care of certain little specific things that are necessary for the elderly, and specific care and specific factors that need to be remembered, because all of these can actually complicate things, as well as when they are taken care of, they can greatly enhance well-being and enhance coping. Another thing which we really forget is that the amount of stress that comes from taking care of a chronically ill elderly is perhaps quite larger than for many other age groups. Of course, there are other vulnerable age groups also, like children, but with the elderly also there come a lot of specific problems. So it's also important to remember that caregivers themselves need care. If both these factors are taken into consideration, the specific needs of a specific age group and the care necessary for the caregivers, then illness in the elderly can still become an experience that brings about a wholesome solution, lot of rehabilitation, and a lot of satisfaction for both the patient as well as for the caregiver.